Members, we have a quorum, so I call this meeting to order. Members, please refer to the seating plan for room 1 and take your respective seats. We have 2 items today. One is portable welfare benefits and elderly services, and let me invite the administration to come in. Meanwhile, if you're interested to speak, please press the button. And let me remind members that if necessary, you should declare your interest before you speak. Let me welcome the administration to the meeting. We have Mr. Ho Kai-ming, Under Secretary for Labour and Welfare, Ms. Anissa Ma, Assistant Director, Mr. Tan Tik-yi, Assistant Director, Mr. Clement Wu, Under Secretary, and also Mr. Benjamin Mok, Deputy Commissioner for the GBA Office. So Mr. Ho Kai-ming, Under Secretary for Labour and Welfare, please walk us through the paper, but please be succinct. We have many members waiting to ask questions. Thank you, Chairman. The Hong Kong government provides various welfare benefits and facilitation measures for elderly persons who prefer to live in the Guangdong province. And we have, for example, the OAA and OALA. We have portable schemes. They are portable to GD or Guangdong. And in order to provide suitable assistance to the elderly, about 20,000 elderly retirees in Guangdong are provided with financial support. And for elderly persons retiring in the Greater Bay Area, they benefit from these measures. For example, starting the 1st of September, the normal and high rates of OALA were combined, and they also benefit from the new high rates and more relaxed assets limits of $350,000. And in order to provide greater flexibility to elderly retirees in GD, in Policy Address 2021, the government suggests that the absence from Hong Kong period requirement should be relaxed, and we are taking forward this proposal. And since 2014, the government had launched the pilot residential care services scheme in Guangdong to purchase places from the 2 RCHs in Guangdong, operated by the NGOs in Hong Kong, and the government regularized the services in 2020. And to facilitate elderly persons to retire on the mainland, the 2021 policy address announced that the government would extend the scheme to cover other RCHs in the mainland municipalities of the Greater Bay Area. And we're working on the details, and we will provide timely report to the panel. That concludes my briefing. Let me read out the names: Mr. Chan Kin-po, Chen Chen-ying, Ma Fong-kwok, Yang Wing-kit, Kingsley Wong, Deputy Chair, Andrew Lam, Ms. Maggie Chan, Mr. Chen Yong, and Mr. Peter Shiu. 9 members. Each will have 4 minutes, questions and answers included. Mr. Chan Kin-po. There are a number of excellent schemes, Guangdong schemes, provided by the government. Well, there are 19,800 users. That's a small number. And about the portable CSSA scheme, it has a lot of merits, because the same amount would allow an elderly retiree in Guangdong to have a better living environment. But there were about 650 recipients under the scheme as at the end of August, and the number is again on the low side. And for the RCHEs in Guangdong operated by Jockey Club, some 200 residents have been received, and that's again the low number. Can you explain about the low utilization rate and try to find a solution? Because despite the good government objectives, you have yet to achieve what you set out to do. after rolling out the scheme, if you don't improve them, then there is more to be decided, and that these are, after all, 3 excellent schemes that could meet the needs of development in the Greater Bay Area, and we can help elderly persons in Hong Kong retire and live in the GBA. So are there plans to improve these 3 schemes? Thank you, Chair. Thank you, Mr. Chan Kin Por. Let me take this opportunity to explain the situation to members. Now, about the few participants under the portable SSA scheme or CSSA scheme. Now, the rate is just slightly higher than the OALA, but if you get OALA, the eligibility criteria are more relaxed than the CSSA, and that is why we have users migrated from the CSSA scheme to the OALA scheme. And that explains the low number of CSSA recipients. Also, for the elderly services residing in R6s in Guangdong, it takes time for elderly persons to adapt to the living environment there, and some elderly believe that they prefer to receive medical and healthcare services in Hong Kong, and there are also other health reasons, etc., affecting their decisions. So, on improving these schemes, as mentioned just now, in last year's policy address, the government suggested that the Guangdong scheme would be extended to incorporate even private care homes. Now, for health care reasons and other reasons, we need to make a joint effort with other bureaus to improve the portable schemes. Yes, Mr. Chan Kin Por. Well, for Guangdong schemes and the portable CSA schemes for elderly, now you explain the reason why people are deterred to join the schemes, but you need to spend a lot of money to build an RCG. You need land, you need manpower, and you'll be spending millions. In order to provide better support to the Guangdong scheme, say apart from the CSSA standard rates, you can subsidize each recipient with some $3,000, and this will benefit both the government and the recipients. So this will be a better option than building more RCGs. For those in subvented homes, they receive a supplement of $2,000 a month. For the 2 homes in GBA, there is 0 fee. We need to look into whether the price difference of $2,000 would incentivize elderly persons to retire in the GD. But after all, we need to meet the needs of elderly people in Hong Kong as well. Mr. Ronald Chan, Under Secretary, and the paper refer to the portable welfare benefits, including GD scheme, and also the pilot residential care services scheme in Guangdong. Those schemes were rolled out in 2014, and some schemes cover not only Greater Bay areas, but also other mainland cities. That means these schemes were already put in place before the outline development plan for the GBA was rolled out. It's not for facilitating GBA development. So apart from these measures in the papers, are there new initiatives rolled out after the implementation of outline development plan for GBA to facilitate its development? Do share your ideas with us. Mr. Chan Kin Por mentioned that there is keen demand. There isn't keen demand, and only some 2,000 elderly persons have joined the pilot residential care home scheme in Guangdong, but 24,000 applicants are waiting for a subvented home place or RCHE place. I understand that an elderly applicant would need to surrender a public housing unit if they get a place in an RCHE, and some elderly people may be concerned about not being familiar with the living environment in Guangdong, and they may have reservations. So how about providing a buffer period say if they live in Guangdong for 6 months and find it all right, they can then surrender the public housing unit. Will you consider providing a buffer for these elderly persons? Under Secretary. Thank you, Mr. Chan. Well, earlier, Professor Lam Yat Singh conducted a study on retirement on the Greater Bay Area. He proposed the same idea, that is to provide a buffer for them. We can look into this suggestion. At the moment, the Housing Department provides a letter of assurance to an elderly participant to the scheme. So in the future, should they wish, they can just provide this letter of assurance to the Housing Department to get a flat, not immediately, but much quicker than ordinary applicants. So we do have this arrangement, but Assistant Director, you want to supplement? Thank you, Chairman, members. For elderly persons who would like to live in the 2 homes in Guangdong and find themselves not adapted to the environment, or for other reasons they would like to come to Hong Kong, we do allow them to come back. And they would be given an EA1 RCHE place. So for various reasons, if they wish to come back, there would be some arrangements to take care of them. What about the other question? He hasn't answered the question. Is it the buffer or no? These schemes were rolled out before 2014. After the announcement of the outline development plan for Greater Bay Area, are there new initiatives to facilitate retirement in the Greater Bay Area? We continue to liaise with the mainland counterparts. There are certain retirement schemes in the Greater Bay Area, and especially after the 14th five-year plan, we are reaching out to address certain bottlenecks, but we find it difficult in midst of the pandemic. But after the pandemic subsides, we will be visiting the relevant municipalities and discuss the arrangements with them. Mr. Ma Fung Kwok. Thank you, Chair. A question on elderly services. The government purchases places from the 2 homes for elderly persons in Hong Kong who would like to retire in Guangdong. In fact, 10 years ago, I visited these homes, and I visited 3 or 4 times one of the homes in Shenzhen. What I don't understand is that the government has not further rolled out other RCHEs in Guangdong. And it's just 248 recipients at the moment, instead of 2,480. What is the bottleneck? What is the obstacle hindering your extension of the scheme? Because at the construction stage, you have a subsidy from the Hong Kong Jockey Club, and the government will be the facilitator to encourage elderly persons to take up a place in these homes. Say, geographical location, Shenzhen is a premier location, and we always talk about a 1-hour living circle in the Greater Bay Area. Is it because you don't have other supporting measures? Is it because it's difficult for family members to take transport to visit them there? And just now, another member mentioned another point, public rental housing. Has the government conducted an in-depth study to find out exactly what's stopping the elderly persons from taking up the quotas? Is it because of a land issue? Is it because of other supporting measures? I find this to be one of the most important initiatives in elderly services. It's been 8 to 10 years without, and there hasn't been any progress. In Zhaoqing, there are only 34 residents. Why not consider building a community to house several thousand elderly population? Why don't you provide other supporting facilities as well? you should not stop at operating 2 homes and subsidizing places. It's not a long-term elderly care initiative. I'd like to have a proper response from the government, please.
Undersecretary. Well, I think location is very crucial. The XRL can convenient elderly to choose to retire over there, but unfortunately with the pandemic, everything has been suspended and we're not able to cross the border. I'm sure that some who live in the Northern District may be interested. And we know that the Shenzhen RCHE will expand into a second phase arrangement. And therefore, we know that location is very important. For the RCHE in Zhaoqing, the Helping Hand Home, the XRL has only just reached this area, and it will take some time for people to adjust to this 1-hour living circle. We are just providing one option for the elderly. We are not trying to push them to retire on the mainland. Instead, we just want to convenience them and encourage them. We know that there is a long waiting list, and we subsidize around 38 months for the elderly homes in Hong Kong. However, in the Zhaoqing and Shenzhen elderly homes, the elderly can immediately be admitted. And so this is a very strong incentive for the elderly to move over there. Mr. Yang Wing-kit, I would like to raise 3 points. One, on the residential care services scheme in Guangdong. Many people want to retire in their own homes or in their own areas. Well, you don't want to retire elsewhere. They want to retire in their place of origin. But you only have the option of Shenzhen or Zhaoqing. It's already incredible to see a 70% occupation rate in these 2 homes. To be successful in this pilot scheme, different cities in the Greater Bay Area should offer such services. You can either build your own RCHEs or to purchase residential care services from other LCHCs in the GBA. Why can't we expand the arrangement and not to wait for subsidies or money for the Hong Kong Jockey Club? We can just take the initiative and work with the GBA elderly homes. We should take the initiative and work together with them. Macau has been doing the same. Why can't we do that? I'm sure by doing so, we'll be able to encourage more elderly to retire on the mainland. Second is the relaxing of the residential period in receiving subsidies. Some people have been living on the mainland for a long period of time. However, they need to reside in Hong Kong for no less than 56 days to be eligible for the allowance. I think this is really harsh. Elderly people who have been living on the mainland find it difficult to return to Hong Kong because they do not have a place to reside in. So to require them to stay for 56 days is a bit too much. Let alone 1 year. You're encouraging people to retire on the mainland. Some elderly want to return to the mainland after receiving their benefits. They may not live in Hong Kong for the long term. However, with such harsh requirements, you are limiting those residing in Guangdong or elsewhere to come back for their allowances. Another point I'd like to raise is the issue of tax concessions for those who have parents residing in the GBA. According to the tax requirements, elderly who reside on the mainland actually could not benefit from tax concessions in Hong Kong. So do you want the children not to provide for their parents? We must look at the overall picture, because on one hand you're encouraging people to retire on the mainland, yet on the other hand you're not offering them with the benefits that they deserve. All right, 3 questions. I'll defer the third question to my colleague. When we started with the GD scheme and with the merger of the normal and higher OALA, we also offer a relaxation of absence limit, so there should not be a problem. And then for purchasing services of residential care services on the mainland, we do have certain requirements, and we welcome those who are eligible or who can fulfill the requirements to register with us. And we encourage people to also to open RCHEs in the GBA. Mr. Kingsley Wong. Thank you. I would like to reflect some of my views. The GD scheme and the Fujian scheme can really encourage elderly to retire on the mainland. However, can you actually extend it to Hainan? I see the information given by Hainan organizations that there are around 400,000 people who are from Hainan, with 60,000 over the age of 50 and 40,000 who are eligible to receive OALA. Can the government also consider extending the GD scheme and the Fujian scheme to Hainan to convenience those who are from Hainan to reside there? I declare interest. I'm on the committee of the Hainan Municipal Committee. And we must also look into how Hong Kong can integrate into the GBA and to try to convenience the elderly, and not only to try to arrange it to our convenience. There are like 15 small rural cities in Guangdong, and of course people would choose to retire in suburban areas. On the mainland, there are already many RCHEs. In Zhongshan, an NGO organized RCHE can provide a care service for around 3,000 yuan. In Hong Kong, the cheapest one is around 16,000. Can we try to assist those who are eligible to stay in those RCHEs and not to ask NGOs in Hong Kong to build or establish their own RCHEs? I see that there's a requirement that Hong Kong NGOs and private organizations must be the ones to operate the RCHEs in the pilot scheme. Should we open up to other RCHEs that as long as they are accredited RCHEs on the mainland, they can also provide residential care services to the elderly from Hong Kong? We must try to look at it from the interest of the elderly. We always think of ourselves, but we do not think of how we can work together with the policies on the mainland. We must consider other operators. We should also respect the monitoring mechanism on the mainland. Well, whether it can be extended to other provinces and municipalities, I have answered this before on another occasion, that it's very difficult to take care of over 10,000 people in Guangdong. We do have one in Fujian and another one elsewhere. We must consider the operations of the RCHEs to see whether we should delve into more cooperation with the mainland operators. From the perspective of the SWD, we must also monitor it because we are using public funding. We must ensure the quality of the services. So for mainland operated RCHEs, we must also monitor the operation before we can decide if they are eligible. Mr. Andrew Lam, I'd like to follow up on the question on elderly services. So the pilot scheme has been launched since 2014. Even though we had the pandemic, 2014 till today is only a short period of time. I want to know about how long the pilot scheme would be in place. I want to see a timetable. When would you see a more definite scheme in place? 87,300 people are residing on the mainland, and that is the number from 2021. However, not many people are using such services. We are not asking all the elderly to move into RCHEs. We also have elderly aging in place policy in Hong Kong. Here I would like to raise an example. The elderly card in Shenzhen has been rolled out since 2021. So it's a kind of smart service, and it can support aging in place. And this card will allow those from Hong Kong and Macau to apply as well. So this kind of smart services can help the elderly to age in place and to receive other residential care services. The elderly can even receive benefits or concessions by using the card for certain services. I just want to have a better understanding on whether this could be part of your consideration in policy, because some of the elderly may not decide to live there forever. They may decide to return to Hong Kong for some time. Thank you. As I said in the beginning, in 2020, this pilot scheme has already become permanent services. So this would be a permanent subsidy from the Hong Kong government. We are looking into whether we could extend it to private RCHEs as well. Currently, we're in discussion with the operators, but at this moment, we are not able to vet the RCHEs on the mainland. There are different concessions given by each city and municipality, and therefore we will need to discuss this thoroughly before this could be done.
Now, as Mr. Lam mentioned, aging in place in Shenzhen, I understand if you have a resident card, you can apply for a senior card. As to how we can chip in to help, in terms of cost, our help is not needed. And second of all, as long as you have a resident card, you can apply for a senior card in Shenzhen already, and you'll be able to use elderly services in Shenzhen. As for Hong Kong government's role, we provide allowance under the Guangdong scheme, but we will consider further how we can provide more help. Ms. Maggie Chan. Thank you, Chair. I'd like to ask about healthcare. First, about the healthcare vouchers. Well, Ms. Maggie Chan, this is an item on welfare benefits and elderly services. Do you have questions on elderly services? All right. My follow-up question is on 280 participants in the 2 homes operated in Shenzhen. I want to know whether the government's providing support. Will the threshold be too high? And as for other points, I think other members already covered them. As I understand, Chair, these 2 RCHEs are operated by NGOs. Now, whether they encounter difficulties in operating these homes, I'd say, for example, they would need to help get social insurance in Shenzhen, and indeed it's a high threshold for NGOs to meet if they are to operate an RCHE in Shenzhen. Last year's policy address floated a suggestion, but because of the epidemic, visits are not working at the moment, but we need to resume quarantine travel first before we can all go to visit the homes. As mentioned by members, cost is another matter we need to consider, and it's about $3,000 for each place. We provide $9,000 per subsidized place. And we need to pass this job to RCHE operators who are more flexible in attracting elderly persons to go retire in their homes. So we need to gauge a market response and allow private homes to give it a try. A follow-up question, Chair. I've received complaints from Hong Kong residents retiring in Guangdong that there are just 2 RCHEs, and that's not enough. And Undersecretary, you mentioned considering how you could better help them. Of course, the epidemic is one factor, but I'd like to have a concrete timetable and roadmap. Don't just tell us you wait until the epidemic subsides. It is an important issue, and if you only start planning when the boundary reopens, it will be too late. You need to have more concrete discussions with the sector and give a better explanation. Thank you, Chair. Responding to Ms. Chan's point, there are about 200 places available in these 2 homes. They charge 0 fee. Upon assessment, eligible elderly people can reside in these 2 homes. About a concrete timetable and roadmap, the time frame is from now to 2025 because we follow the 14th five-year plan, and we should have a better idea of all the unique features of municipalities. For some mainland cities, they may have the different positioning. They may opt for franchise services, and different cities will have a different degree of an aging population. So in terms of residential care home for the elderly, we may have different strategies. Next, Mr. Chen Yong. We're supposed to wrap up this item by 11:45, and a number of members are still waiting to speak. Some members would like to speak again. So depending on our progress, I may allow a second round. If you're interested, please press the button now so that I know where to draw the line. Mr. Chen Yong. Thank you, Chair. On portable welfare benefits and elderly services, the Undersecretary and his team has made a lot of effort. And I understand for these two homes, initially they faced even more difficulties. And the CE also agreed that we should have regard to the GBA development as a whole. Let's not talk about the history. Let's focus on our incumbent CE, John Lee, and we should make a bolder move. In fact, at the party congress, every year we make the same suggestion. Our country attaches great importance to elderly services. So for portable welfare benefits, apart from CSSAs, OALA, next part we'll be talking about medical services. And I look forward to more frequent exchanges between NGOs operating services on the mainland and the Hong Kong SAR government. In the past, some initiatives might be difficult to implement. Now, we can start with 9 cities in the Greater Bay Area. If some cities are ready, then we can try pilots in these cities. I believe that the CPPCC members can also chip in. We can also table motions in next year's party congress. So instead of waiting for the boundary to be reopened, we should make ourselves ready. If we have portable welfare benefits as well as healthcare services, many elderly persons would be willing to go to the mainland. So we're talking about comprehensive support. If the government is able to achieve that, you will alleviate the pressure on Hong Kong in providing elderly services. And not only that, when elderly persons retire in the Greater Bay Area, they will find quality living there. And elderly services should not only be about residential care homes. It's a bigger market. Instead of placing the burden on mainland cities, you are bringing in opportunities, especially when the elderly in the middle class also go. This will go to the mainland. This will bring development opportunities to these cities. So as we ponder on the new chapter, these are things we need to consider. Thank you, Mr. Chan, for the suggestions. I think you're referring to 2 types of people. First, elderly people. They need to know more about the Greater Bay Area and be instilled with confidence in retiring in the Greater Bay Area. Second, whether private operators are familiar with the mainland operations and policies. There are, well, for example, in Huizhou's 14th five-year plan on the provision of elderly services, Huizhou would like to have accredited bodies operating or providing these services, and Hong Kong enjoys the strength in this regard. So first, we need to have regard to the unique planning, the planning unique to the 9 respective cities, and we also need to consider Professor Lam Yuk Sing's study. The 9 respective cities have their own planning, and we need to explain this to the practitioners. Mr. Peter Shou. The government's objective is to encourage elderly persons to retire in the Greater Bay Area. I think we're heading in the right direction, because decades down the road, one elderly people will be supported by not 3 or 4 but 2 people in Hong Kong. So we're an aging society, and I think we are in the right direction in encouraging elderly people to retire in the GBA. About that pilot scheme rolled out in 2014, 8 years down the road, only some 300 elderly residents stay in these homes. We have a long queue for RCGs in Hong Kong, and elderly people are deterred from going to the mainland RCGs. So I say this is not a successful scheme. If the living environment in these 2 homes are much better, and if there is financial support from the government, why aren't our elderly people going to these homes? The government should conduct a review. Our population is aging fast, and for CSSA, the rates range from 3,000 to 6,500 plus, and for OALA it's from $1,500 to $3,900. And these are welfare benefits enjoyed by Hong Kong elderly people, and the government subsidizes each subvented home place for over $10,000. If instead the government opts for a place in RCHE, definitely the living environment would be much better, and the subsidy amount would be far below $10,000. So is there something concrete you would do, or would you just repeat every time that since the places in the Shenzhen and Zhaoting home have not been fully utilized, you would not think of anything else? I'm afraid I have to repeat the previous answer. If you wait for a bought place home, it takes 8 months, but if you go to these 2 homes, you don't need to wait. For a subvented home in Hong Kong, each participant pays about $2,000. If you go to the Greater Bay Area, you are not charged for anything. So would you rather wait for 8 months to secure a place in a home in Hong Kong, or would you rather skip the queue and go to the homes on the mainland at once? That's for the elderly person to decide. After all, we provide care to our elderly population. We provide the amount, regardless of whether it's several thousand or 10,000, in order to take care of our elderly. And the private the care home operators would need to, use some new gimmick to attract them to go to the mainland. Now, Undersecretary, I don't suppose you have gone back to visit these 2 homes recently, and the Hong Kong people are unable to visit these 2 homes either. So you can prepare some short videos to tell Hong Kong people how good they are. We have been mounting publicity, and let me just supplement. We try to understand why some elderly people stay in these homes and why some don't, and basically the residents are happy with the living environment. The major reason basically is whether they can maintain close ties with families in Hong Kong. But on the other hand, for example, some elderly people might have stayed in the mainland for quite some time, and their children might be working or living in the mainland. So if they have strong connection and close ties with families on the mainland, they will be better incentivized to take a place there. Right, just make use of the TV program Scoop and prepare some short videos.
Well, we still have many members waiting to speak. There are 4 who are still waiting to speak in the first round and then 7 in the second round. So for the second round, I might just allow you to ask your questions and then ask the administration to provide an answer in written form. It's my turn now. Well, we all understand that the scheme has been launched in 2014. However, only a small number of people reside in these 2 RCHEs. And those who move in stay there, they do not move out. And due to the pandemic, you're not able to go visit. We understand that elderly services is a long-term problem. You must go up and take a look. I am in agreement with other members that we must open it up to other cities so that more RCHEs can join and allow more elderly people to move up in accordance with their own desires in where to live. As you said, the elderly would not move up alone. They usually would move if they have friends or family over there. You say that for some cities, not many people will choose to stay there, therefore you will not extend the scheme to those cities. That's not the case. When there are 4 or 5 who are thinking of going to the same place, then other people would join as well. I hope the administration can consider trying to campaign to the existing RCHEs or to showcase this to those who are in their 50s so that people could plan early on whether they would like to retire in the Greater Bay Area. Mr. Andrew Lam mentioned aging in place. Many people are still strong and healthy. Therefore, I think you should come up with policies for different kinds of elderly. Some may still be healthy and able-bodied. Some need more long-term care. You must draw up different schemes for different kinds of people and then to work on campaigning it to the elderly. There have only been 200 odd people joining this scheme since 2014. Can you say that it's successful? We believe that it's a very small number and there should be more done on this end to encourage more people to move to the GBA. Well, thank you for your views. Well, we cannot just go up by ourselves. We must go with the sector. And actually, the sector is very busy through the pandemic. Therefore, they would need more time to prepare for a trip to the mainland. When they're willing and have the time to go, we of course would join them. And you are correct. Those who are in the line for RCHEs in Hong Kong are those who are relatively weaker. And the more healthy and able-bodied ones would choose to reside in GBA. They do not need long-term caring services and they're looking for just accommodation for the elderly. We should and we would look into such arrangements. At this moment, we do not have any plans though. Next, Ms. Jovi Chen. Thank you. I'd like to follow up on Mr. Chen Ying's question, which is the crux of the issue. The portable welfare benefits and elderly services in the GBA have not been updated since 2014, and those are actually not in line with the development in the GBA. Even for a pilot scheme, it has been on for 8 years and with very few participants and only limited to 2 cities. The pandemic is not an excuse because we didn't see the pandemic in 2014 to 2019, and we were able to take the bridge over to the mainland or take the XRL to the mainland during those 5 years. Undersecretary, you know that even Xiaoming has been to Guangzhou before. Why didn't we see such a development in the policy? These 2 RCHEs in Shenzhen and Zhaoqing only have around less than 300 residents. However, we do see a high demand in cross-border elderly services. We must ensure that these 2 RCHEs could provide better medical services as well, so that the elderly can retire without worries on the mainland. So now the government has also relaxed the absence limit. Hong Kong people could receive allowance in Hong Kong. However, those who want to move to the GBA must also reside in Hong Kong for a period of time. Currently, they must also apply in person. Could we also allow proxies to help them with the applications so they do not need to return to Hong Kong themselves for the application, so that these benefits could really become portable? Thank you. I have already spoken about this, that this scheme has been regularized since 2020. Therefore, this is not a pilot scheme anymore. The pilot scheme has already been changed to a regular scheme in 2020. I have also made some videos on the GBA. Well, once we are able to cross the border conveniently, more people would move up. We would have to wait till that day before we can carry out a further discussion and to encourage more people to retire on the mainland. Dr. Low can tell us more about medical services in the next item. In Zhaoqing, we are already working with a hospital nearby. We are not sure whether the residents really want to choose this kind of medical services. It's up to them, however. Well, time is very tight. Would those who are waiting to speak for the second round ask your question in writing? Because there are 7 in line and I really don't have that much time. Next, Ms. Carmen Ken. Thank you, Madam Chair. We have seen from the paper not a lot of analysis on the issue. We know that we see an aging population and there are plans for people to age and retire on the mainland. Could the administration tell us more about their plans in the future? So how did the administration think of the scheme since 2014? We only see like 282 residential care service offered since 2014. However, there are like 80,000 people living permanently in Guangdong, and there are around 20,000 elderly living over there. So what is the problem? Why are not there more people moving into RCHEs? We see that there are many new task forces coming into place. Would there be a task force to look at the problem at the GBA, and can something be done through the task force? Can the CMAB also, since we are not able to cross the border at the moment, to work in this area? Well, at this moment, we cannot conduct any analysis or inspection. But we have heard views where the reasons lie. Well, some of them are easy to overcome, but some are unknown at this moment, and we're going to try to deal with this step by step. I think it was a year ago when we set up a task force with Shenzhen on elderly care services. We have exchanged our ideas, and our colleagues are now following up on such work. Assistant Director. Well, the Undersecretary has answered the question about the task force. The government has already been in discussions with certain municipalities and cities, but for assistance required for residential care services, if they come over to our economic and office in Guangdong, we're also able to provide assistance. Well, I hope that you would really follow up on this. Since there is a task force, it shouldn't be a hindrance. All right, Ms. Lam So-wai. Thank you. I have some concerns in regards to portable welfare benefits and elderly services. As of July this year, there are around 19,000 people in Guangdong scheme and about 1,900 around in the Fujian scheme. But then permanent residents living in the GBA are around 90,000. Have you looked into why those who are in the Guangdong scheme, only about 20% of the total number, why are they not able to enjoy such benefits, or why are they not applying for such services? Secondly, as other members have said, the pilot residential care services scheme in Guangdong was rolled out in 2014, but as of today, there are still only 2 RCHEs, and the Helping Hand home in Zhaoqing has only seen a very low occupation rate. So it seems that we are wasting our resources. In the 2021 policy address, it was mentioned that residential care services will be extended to other cities as well. Do you have a timetable on when and how it will be extended? And when it is extended to other cities, how are you going to attract elderly people to move up to those cities?
About portable benefits. For the 19,000 elderly people, some are on old age living allowance. Some could only get old age allowance because of not meeting the asset limit requirement. Now, we haven't found out whether it's the former or the latter. Maybe they don't want to go through the trouble of applying for allowances. I understand there are 2 banks that provide remittance fee waivers for remitting allowances to the mainland, and we'll continue to enhance publicity to let them know that they are eligible for these allowances from Hong Kong without having to pay for remittance charge. Timetable. We don't have a timetable yet, but we will visit the mainland as quickly as possible with the sector to discuss the setting up of homes on the mainland. For example, whether we can have the support of the municipal government. Mr. Jeffrey Lam, please switch on his mic. Thank you. Yes, your turn. Not coming through. Please switch on Mr. Lam's mic. Right, coming through now. I lost 10 seconds. Chair. Our elderly people have been serving Hong Kong for so many years in their different positions, and I think we should treat them well as they retire because of the contributions made to Hong Kong. It seems to me that the government doesn't have any plan. It seems that you can operate a home wherever you like. In the 5th wave of the epidemic, it has been revealed that the government is making such a mess in providing elderly care. We don't have sufficient manpower. The living environment is not satisfactory, and we can't even import care workers to take care of elderly in these homes. As a result, elderly residents in the care homes have been infected, and some of them have passed away. Is that in line with our country's objective? I don't think the government is doing enough. We have the Northern Metropolis Strategy in the New Territories, spanning some 300 square meters. And yet the government is shutting the doors to many ideas, utilizing greenbelt sites in the country parks. It's not inhabited. Why can't we allocate land for the purpose of building care homes? Why can't we do that? The government always says no because it's a country park site, it's a greenbelt site, is untouchable. I really hope that the government could conduct a comprehensive review on residential care homes for the elderly, as well as the manpower required. Undersecretary, don't just give a nod. I really want a detailed report from you to facilitate the Council's discussion, because every time you just give a nod and then nothing else. Indeed, you have many schemes in Guangdong or in whatever, wherever. And it is the government's intention to extend the pilot residential care services scheme in Guangdong to cover other cities in the Greater Bay Area. Now, what is your progress? Have you selected the locations? I need to know your progress, and I need a timetable. you should make it convenient for Hong Kong people to use elderly services there. All right, so these are the two questions for you. Under Secretary, Mr. Lam referred to RCHEs locally, and I invite Mr. Lam to come to the Bills Committee on the Residential Care Homes Bill, and we're improving the regime. I'm sorry, Hong Kong is part of the Greater Bay Area, and we're talking about elderly services in the Greater Bay Area. Why can't I talk about these issues here? Why should I go to the Bills Committee? Right, but today we're talking about facilities in the Greater Bay Area. Well, isn't it, aren't we one of the cities in the Greater Bay Area? Greater Bay Area means 9 cities and 2 special administrative regions. Hong Kong is part of Greater Bay Area. Don't you know? Well, of course, it is beyond dispute that Hong Kong belongs to the Greater Bay Area. But I think the crux of the matter today is about portable welfare benefits. So, Under Secretary, do your best to answer this question. For local RCCs, the matter will be discussed at the Welfare Services Panel. We're making progress. As for the 9 cities in the Greater Bay Area, we are going to join the sector in conducting visits in these cities. So that wraps up the first item. We now move on to the second item, development of medical services. Let me invite the administration to come in, and members, if you want to speak, please press the button now, and if necessary, please declare your interest before you speak. For housekeeping, I'll try to allow more members to speak. If you want a second round, I'll have to see whether the queue for the first round is long. And please be succinct. And if we run out of time, please ask your supplementaries in writing. We have from the administration Professor Low, Secretary for Health, Mr. Simon Chung, Assistant Secretary, Dr. Simon Tang, Director of Hospital Authority, and Mr. Clement Wu, Undersecretary for Constitution and Mainland Affairs, and Mr. Benjamin Mok, Deputy Commissioner for the Development of Greater Bay Area. Professor Low will have the floor. Please walk us through the paper. Chair, members, good morning. I'm happy to be attending this meeting of the Subcommittee on Promoting Development of the Greater Bay Area. The Development Greater Bay Area is a national strategy personally devised and planned and driven by President Xi Jinping. It is key development strategy in the country's reform, as well as a further step in enriching the practice of one country, two systems. The objectives of the development is to further deepen cooperation among Guangdong, Hong Kong, and Macau, fully leverage on the composite advantages of 3 places in order to build a Bay Area ideal for living, working, and traveling. And in order to achieve that, medical services is the key. As of 2020, there was 86 million in the Greater Bay Area, people in the Greater Bay Area, and there are ample opportunities. We have highly efficient healthcare system with excellent quality, and we will continue to give play to our strengths so as to drive cooperation in the Greater Bay Area on the provision of medical services. Details are set out in the paper, which has been circulated to members, so I'm not going to go through all the initiatives here. I just want to share with you The three initiatives that reflect the government's determination to make a reform and drive innovation. The first one is a special support scheme for chronic disease patients of the hospital authority residing in Guangdong province. Under the scheme, in the past, it was very convenient for Hong Kong people to seek medical help in the mainland. That is before the epidemic. But because of the epidemic in the past 2 years or so, it was almost impossible for Hong Kong residents to come back to Hong Kong for medical consultations. That is why in November 2020, the Hong Kong SAR government commissioned the University of Hong Kong Shenzhen Hospital to provide subsidized follow-up consultations for chronic disease patients with scheduled appointments at the GOPCs of HA. The next initiative is cross-border use of electronic medical records. As mentioned in the aforesaid special support scheme, in order to facilitate patients' follow-up medical appointments with the patient's consent and authorization, we allow their medical records stored on the electronic health record sharing system or e-health to the Hong Kong U to be shared with the Hong Kong U Shenzhen Hospital so that the hospital would get accurate information in dispensing the drugs to be used. And we'll draw reference from the practical experience gained from the special support scheme and actively consider the further implementation of cross-border use of electronic medical records so that Hong Kong patients would receive more accurate diagnosis and treatment on the mainland. The third initiative is the use of Hong Kong elderly healthcare vouchers in the mainland cities of the Greater Bay Area. Since 2015, the Hong Kong elderly healthcare vouchers could be used to pay for the fees of outpatient services in the Hong Kong U Shenzhen Hospital. The plan has been regularized since June 2019 and will continue to monitor the use of vouchers in the Shenzhen Hospital and then see how we can better make use of the voucher schemes to subsidize Hong Kong patients in using healthcare services in the mainland. In a key speech delivered by President Xi Jinping on the 1st of July this year on the establishment of Hong Kong SAR, he mentions 4 expectations and that we need to maintain social harmony and enhance our governance. So in terms of healthcare services, the government should take the lead and be bold to improve our healthcare system and joint development with the Greater Bay Area and drive for a reform. And we'll continue to make a joint effort with the public and the sectors to build a healthy Hong Kong in line with the National Healthy China initiative with a view to making greater contribution to the development of the Greater Bay Area and the country. I'll be happy to take questions from members. 12 members are waiting to speak. Let me read out their names. Mr. Chen Chen-ying, Peter Shiu, Yang Min-kit, Ms. Maggie Chang, Lam So-wai, Reverend Peter Kuhn, Mr. Chen Yut-ming, Mr. Kingsley Wong, Mr. Chen Yong, Mr. Jeffrey Lam, Ms. Carmen Can, and myself. 12 members in total, 4 minutes questions and answers included. We start with Mr. Ronald Chan. Thank you, Chair. Professor Low just referred to special support scheme, the e-health record and its cross-border use, as well as the Hong Kong elderly healthcare vouchers in the mainland. These are all good initiatives, but I have 3 questions in relation to the Hong Kong U Shenzhen Hospital. It's a special arrangement. As of September 2022, the hospital handled around 20,800 applications. The response is very keen. Is it possible to regularize the scheme? And drawing on this reference, can we extend the scheme to the 3A hospitals in 9 cities to facilitate Hong Kong patients in medical consultations in the mainland? Next, about fees. I think this is a major expenditure item for Hong Kong residents living in the mainland. on the 30th of August, the first medical center for Hong Kong residents in Guangzhou was commissioned. And apart from the Hong Kong Yu Shenzhen Hospital, there is now another choice for Hong Kong residents. However, it leaves more to be desired because the healthcare vouchers cannot be used. Only the medical insurance can be used to offset the fees. Will Professor Low consider utilizing the center as well?
Thirdly, the insurance companies all have a list of accredited medical institutions on the mainland. Well, usually they are 3A hospitals. So, have you thought about subsidizing Hong Kong permanent residents to receive medical services in these 3A hospitals to try to lower their medical fees? Would you consider such new policies? Secretary. Thank you. For cross-border services, including elderly healthcare vouchers, in the scheme with the HKUSCH will continue. The scheme will expire in November this year, but in light of the epidemic development, the government has extended the scheme continuously since November of last year, and we are now in discussion of further extension. The support scheme involves many different factors: the quality of healthcare services, clinical government structure, administrative procedures, operating environment, employee skills of the institution concerned, as well as the views of other stakeholders, including healthcare professionals and patients in Hong Kong. Although there are 3A hospitals, which is the standard on the mainland, there are other service models and indicators. The HKUSCH is able to meet the requirements of our government, and therefore we do not have plans to extend it to other hospitals at the current stage. For NGOs, that is because of the inconsistency of fees. The HKUSCH is using the standard of the government, and we do not want to get involved in the competition with other private hospitals. Mr. Xiu Ka-fei. Thank you, Secretary. Well, I'm sure that you are under huge pressure at this moment to try to open up the borders and relax the pandemic measures. Well, there are 2 points in the paper. One on the measure of allowing designated healthcare institutions to use Hong Kong registered drugs and medical devices. Well, on behalf of the sector, I would like to thank the mainland for development in traditional Chinese medicine as well. We see that some of the drugs and devices can be used on the mainland, and it is very helpful, but only external drugs can be used at the moment. When can other drugs be recognized as well? Secondly, as there is an aging population in Hong Kong, how can we encourage elderly to move up to stay in the mainland to enjoy medical services as well. Secretary. The measure in the access of drugs and medical devices, especially for Hong Kong, we are talking about Western drugs with and devices. As for TCM, there are like 5 external drugs that have been recognized. There is a difference in internal and external drugs because there may be different screening and vetting standards. Well, this will need more thorough discussion on whether those could be included as registered Chinese medicines as well. And for elderly who have retired, we must also consider their medical needs. This is very clear, especially on the mainland. In many RCHEs, there would be a nearby rehabilitation center that can provide assistance. In Shenzhen, Yantian area, there are many elderly people who have moved from Hong Kong, and this is actually a subsidized RCHE by the Hong Kong Jockey Club. Through HKUSCH, we're able to provide them with medical services, and we have set up some pilot schemes. In future, based on this model, we can continue to provide services for the elderly so that they will not need to come back to Hong Kong to receive such services. Mr. Yang Wing-kit, there are around 230,000 people living in the Guangdong area. It seems that HKUSCH needs to take care of all these people. These 230,000 people living around the Guangdong area, they may be scattered across different areas in Guangdong. They might not want to go over to Shenzhen to seek medical services. They might want to just visit a medical institution nearby their homes. Can we provide them with some sort of vouchers so that they'll be able to visit other medical institutions as well? Otherwise, they would have to wait for services at HKUSCH or come back to Hong Kong, and that could also be a burden to our medical services. By doing so, we'll be able to relieve the burden on our medical services and at the same time convenience them in seeking services nearby. I have looked through some papers and found that there are 11 Hong Kong subsidized medical organizations in Shenzhen. So can we try to open up the scheme so that the elderly can visit medical services nearby instead of having them go all the way to HKUSCH? Secretary, thank you for your question. China is a huge country. to provide a high quality medical service in the Greater Bay Area is challenging enough. At the current moment, only HKUSCH has been commissioned to provide subsidized consultations. The Chinese University of Hong Kong has also started up a medical school in Shenzhen. If they can reach a certain standard, we can consider extending the scheme to it as well. For other privately run institutions, they are profitable organizations, and we must be very careful not to get involved in competition between public and private institutions. I would like to follow up. Our elderly healthcare vouchers in Hong Kong can be used in private clinics as well. So why can't this also be adopted on the mainland? This seems not consistent. The management on the mainland is different. They run by a different management model. Other than 3A hospitals, we are not allowing other medical institutions to provide services for Hong Kong people. Next, Ms. Maggie Chen. Thank you, Madam Chair. I would like to see whether there could be an extension in the use of healthcare vouchers in the mainland cities of GBA. Members have asked why it can only be used in HKUSCH. In the address given by President Xi on July 1st, he mentioned that we must work together, and medical professionals can also work on the mainland. How can we help medical professionals to work together or integrate with the elderly healthcare vouchers in the mainland cities? And I'd like to talk about the special support scheme. So from $4,000 to $2,000, by May of 2022, it has been reduced to $1,000. Many Hong Kong residents who reside on the mainland are looking for increasing the amount because it is really not enough, especially when medicine is expensive. And this voucher can only be used at HKUSCH. Some people live in Guangdong. They already feel unwell. They have to start early from home to head over to Shenzhen. Even a healthy person would find it tiring. Why do you still want to torture someone who is unwell? There are many chronic disease patients who live on the mainland saying that some drugs cannot be received on the mainland. So how can you ensure that they can receive the drugs needed for chronic diseases? There's already a platform under CEPA for healthcare professionals to establish their footprint in the mainland. We are in full support of that. At this moment, only HKUSCH has been commissioned to provide subsidized care because the SKU SCH follows the Hong Kong management model, which is different from the model on the mainland. And it's easier for Hong Kong elderly persons to adapt and accept. We need to consider various factors, including the quality of healthcare services. Therefore, we have to carefully consider whether we want to extend it to other medical institutions. The country is big, and the GBA itself is very challenging as well. There may be people live in Zhaoqing, Dongguan, Guangdong. People live all around the GBA. The best method is for Hong Kong people to purchase medical insurance on the mainland so that they'll be able to enjoy services from any medical institute on the mainland instead of waiting for subsidized care from Hong Kong. Hong Kong residents can purchase a medical insurance on the mainland. And I must also talk about the $1,000 issue. That's only for 6 months. We would extend it every 6 months and to add on 1,000 every 6 months. So altogether they would receive about $2,000 per year. And that is only for outpatient clinics. The elderly healthcare vouchers also offer $2,000 a year for clinic services.
Thank you, Secretary. Next, Reverend Kuhn. Thank you, Chair. In terms of elderly care in the Greater Bay Area, we'd like to leverage on the GBA's strengths. And I think one bottleneck is, as mentioned, medical services. Apart from Hong Kong U Shenzhen Hospital, Secretary just mentioned another option, that is to take out medical insurance in the mainland. I think it would be easier for those in employment. For elderly people, however, if they queue up for public health care, they get services free of charge, and that they get the drugs for free. Now, Secretary, using this blueprint for Hong Kong U Shenzhen Hospital, do you have a timetable when other similar hospitals will be set up in the Greater Bay Area? And also 3A hospitals in the mainland. When will we see subsidy from the government for Hong Kong residents in the mainland to use their services, so that elderly Hong Kong residents in the mainland could receive care and to prepare for our aging population? Secretary, for the time being, we have Hong Kong U Shenzhen Hospital being the only hospital that meets our standard in the Greater Bay Area. But there are other hospitals in development, including some public hospitals operated by our university. As for other 3A hospitals, the mode of operation is very much different from the standards adopted by Hong Kong. So as I explained just now, ideally, one should take out medical insurance. According to our country's plan, Hong Kong residents must abide by the mainland standards if they are to take out medical insurance. It's beyond our control. Reverend? Well, I think I need to follow up on this point on elderly people. Can you address the issue on 3A hospitals? Because I think as 3A hospitals is the key. There are 3A hospitals in different cities, and the system is ripe. The question is how we can help elderly Hong Kong residents seek medical consultation in 3A hospitals. Now, that's a kind of assessment of hospitals in the mainland. Category 3 means it's a big hospital. A means the quality is good. But in terms of management, the model is different from the management model in Hong Kong. In the mainland, there are several 10,000 3A hospitals. We can't say just by looking at the title that the healthcare vouchers can be used and that subsidy can be granted under the health voucher scheme or the special support scheme. Next, Ms. Chen Yupming. Thank you, Chair. I have two comments. First, on the use of Chinese medicine. We have no Chinese medicine hospital in Hong Kong, and many Hong Kong residents are used to getting medical checkups and seeing Chinese doctors in the mainland. And the paper refers to the relevant arrangements. As for the PCM's products prescribed on the mainland, how can they be approved for use? There is a need to improve the situation. On training, on manpower training, according to the paper, medical graduates may sit for a qualification examination. Last year, we approved a bill that is a medical registration bill. So, Secretary, we are confident in the medical schools in Hong Kong. So can we provide an avenue for medical graduates here? After years of practice in the mainland, in these hospitals, can they get the qualifications for practice in Hong Kong? As for Chinese medical hospitals in the mainland, the operation is unique because in a Chinese medical hospital, they combine Western medicine, so they have Western medical practitioners providing treatment, etc. It's very similar to an ordinary hospital. As for the PCMs used in the mainland, not many products are registered in Hong Kong, and we do not have any plan to allow mutual recognition of registration. Now, the Chinese University of Hong Kong has set up a hospital for training, a medical school in Shenzhen, and the Hong Kong is planning to commission a medical school. As mentioned in the paper, however, they abide by the mainland standards, and medical graduates are eligible for qualification for clinical practice in the mainland, not in Hong Kong. Although they are medical graduates in the schools operated by Hong Kong U and CUHK, they do not automatically qualify for practice in Hong Kong because the schools adopt the mainland standards, and they also receive training in the mainland. If they are to seek registration in Hong Kong, they need to go by the registration route for foreign doctors. That is to get special registration. And under that provision, we check whether the schools they come from are on the recognized list. No follow-up. Next, Deputy Chair, Mr. Kingsley Wong. I have three questions for the Secretary. One is cross-boundary medical collaboration. The special support scheme is well received. But like other members said just now, can we extend the special support scheme to cover specialties and specialist consultations and surgeries? Because for specialist operations, the queue in Hong Kong is really long. For orthopedics, for example, the queue could be up to 7 to 10 years. And if we give the green light to Hong Kong Yu Shenzhen Hospital, these patients may be willing to receive operation in the Hong Kong Yu Shenzhen Hospital. So, will the government consider, or has the government considered this option, and what are the obstacles? Second, about using healthcare vouchers. In 2020, our country gave gift to Hong Kong residents. Hong Kong residents can now take out medical insurance using Hong Qin as the pilot, and in August this year, there is subsidy for Macau residents to take medical insurance in the mainland, and the subsidy amount is $1,000. Will the government consider subsidizing Hong Kong residents to take out medical insurance in the mainland using the healthcare voucher? And to implement and to leverage on the country's support for Hong Kong, because according to the previous scheme, it's just $300. This will help Hong Kong residents take out medical insurance in the mainland and utilize the healthcare resources in the mainland. We should do our best. Next, for patients suffering from rare diseases, the medical and drug expenses could be hefty. So can we buy medication in bulk, say for muscular atrophies? The patients require injections, and if we buy in bulk, each injection would only cost $33,000 and not more. And can we have bulk purchases to make it affordable for patients? That is to lower the purchasing cost of drugs to benefit patients. Secretary, about procuring services from the Hong Kong U Shenzhen Hospital, Mr. Dr. Tang from the HA can take this question. Thank you, Mr. Wong, for your questions. We note that we have been working smoothly with the Hong Kong U Shenzhen Hospital under the special support scheme to help Hong Kong people, especially the Shenzhen Hospital is operated using the management model of Hong Kong. And meanwhile, we understand that the queuing time for certain operations is long in Hong Kong. So we do explore whether it's possible to carry out certain operations in the mainland hospital. Well, we need to iron out details, however. For example, preoperative, post-operative care, and also the capital flow. What about drugs for rare diseases? About using healthcare vouchers to purchase medical insurance, we will actively consider this suggestion. And about drugs for rare diseases, under the policy, we allow drugs registered in Hong Kong and not yet approved in the mainland to be used. And you referred to the bulk purchase issue leading to lower costs. The fact is, there are two different procurement standards adopted by Hong Kong and the mainland. Next, Mr. Chen Yong. Thank you, Chair. I thank the Secretary because you are an internationally renowned medical expert, and the public has high expectations on your work. We do hope to see a new chapter. And I think it is inevitable that we collaborate in the Greater Bay Area in the development of medical services. Now, on healthcare vouchers, Professor, you have the experience as you operated the Shenzhen Hospital as the pilot under the healthcare scheme. The DAB hopes that there is a timetable to implement the scheme further. The problem at the moment is the queue to heaven is actually quicker than the queue to see a doctor. And this is horrifying. All the conditions are ready. Over 500,000 Hong Kong residents stay in the Greater Bay Area on a long-term basis. So I think, Secretary, you are experienced in implementing pilots and extending the schemes, using the several cities in the Greater Bay Area as a start. It will be a good deed. And we also need to enhance the 4 connections of medical services. So if we can further facilitate Hong Kong residents in taking out medical insurance, definitely the medical fees in public hospitals in the mainland would be cheaper than the Shenzhen hospital, and we can implement a pilot in this regard.
Go.
For the elderly living in the GBA, we hope that there could be a better mechanism in their assistance for medical services. And on July 1st, President Xi and our CE also talked about opening up new strategies for the medical services development. And since the Undersecretary for CMAB is present today, I hope that you will also understand that with your help, we'll be able to expand it further and to provide more benefits to our people, even to those living on the mainland. And when we encounter difficulties, the Chinese medicine team on the mainland also head over to help us. Now that we have a new administration, I hope that you'll be able to bring us new impetus in such development. Thank you. This is the 10th anniversary of HKUSCH, and this is actually a very strong platform for medical services on the mainland. Under the pandemic, this platform not only provides services to those living on the mainland, it also helps Hong Kong people to receive cross-border services. We are going to continue our efforts and to extend such a platform, and we hope we'll be able to extend the coverage. As for the medical insurance, we'll need to follow with the mainland policies, because there is a huge resource on the mainland on insurance schemes, and there are different regulations in different provinces or municipalities. Well, can the elderly be reimbursed for medical services received on the mainland? Well, we need to look at the reasons behind that. At this moment, the vouchers can only be used at outpatient clinics. We are not able to extend it to reimbursement for hospital admissions at the current moment. Ms. Carmen Ken. Well, Dr. Low has worked at Hong Kong USCH for 6 years before taking the post of Secretary for Health. I'm sure you know of the huge demand for services in the medical sector. At the conclusion of the paper, we see that there is a view to make greater contribution to the development of the GBA as well as the overall development of the country. We understand there is a need in medical services on the mainland, but I want to know what the priorities are from your perspective. So the task force will also work in facilitating in-depth integration within the region and developing international world-class Bay Area ideal for living. I want to know what are our priorities. As for the access to drugs and medical devices, all along in Hong Kong, we adopt the secondary use approval system. Usually, these drugs are credited in the UK and USA, and then it would be approved on the mainland. Should we try to provide more convenience in the first use approval in Hong Kong? Well, I'm a layman secretary. I'm not quite sure whether there is work that can be taken on by the LegCo to provide more convenience in the access of drugs and medical devices. Secretary. Our department is also looking at our priorities, and first and utmost is of the pandemic because it affects the HA and also the economy and our medical services, and we want to ensure that we provide suitable medical services. We must also ensure that we could help those living in the GBA. We are well known for our medical services, and on the mainland, many people commend our services in Hong Kong. We have the capability to improve. We need to also consider more training and to be a pioneer in our innovation. Hong Kong adopts the secondary use approval policy. 32 countries or places will first vet the drugs, and we would look into the analysis. If there are 2 or more places that have approved the drugs, then we would screen the drugs in accordance with those analysis and results. We are actively considering mainland approval because the mainland standard has already reached many international standards, and we would consider including mainland approved drugs, and that would also be one of the standards we adopt in the future. Ms. Ken, how about on the reverse? As you said, we adopt the secondary use approval approach, and the mainland standard is very high. So am I understanding correctly that we can have an exchange of access of drugs and medical devices? How about for Hong Kong drugs going up to the mainland? Would it also be easier for Hong Kong drugs to be used on the mainland? Well, the measure provides such convenience. We use Shenzhen as a pilot scheme area, and there is a new policy that allows drugs that are used in Hong Kong and have been approved to be used in Shenzhen with HAUSCH as the first pilot scheme. And so they will be able to also provide drugs that have been registered in Hong Kong yet not on the mainland. But to have all Hong Kong registered drugs to be approved on the mainland, well, that is up to the mainland. Well, we are going to extend the meeting by 15 minutes. Is that all right with everyone? All right, thank you. Well, it's my turn to ask questions. The Secretary has explained many times why the elderly voucher or health vouchers can be used at HAUSCH. Have you set a very high threshold Well, as we're only adopting the Hong Kong management model, not many hospitals can abide by this model. Can the healthcare vouchers be used elsewhere, such as to purchase medical insurance on the mainland? Is this feasible? It's difficult to ask other hospitals to adopt the Hong Kong management model, and not many will be able to comply. You may have explanations for the 3A hospitals, but how about other hospitals? Can we try to provide more flexibility in the use of the healthcare vouchers? I have a question on the electronic medical records. Well, of course, it can only be shared and used during consultations at the HKUSCH. Can the health record follow the patient, especially X-rays? Many patients complain that also have to bring their X-rays along with them to consultations. Can you allow them to carry the records with them so that other doctors can also make use of those records? To apply healthcare vouchers in other hospitals, we must first ensure the quality of the healthcare services. As to whether it can be used to purchase medical insurance, we are considering this carefully. Electronic medical records can only be allowed to be for use at HKUSCH or with the patient's consent. The patient's records can be shared to HKUSCH, but there needs to be careful screening, as Hong Kong USCH is very familiar with the Hong Kong system. I myself participated in that work. It takes careful planning to allow the use of electronic medical records. Other hospitals may not be willing or be able to make use of these e-records. Or as to reading X-rays through e-health, we also need to look into security of data. It is not automatically sent to HKUSCH. It's just that the medical records are encrypted and then sent over to HKUSCH under patient's consent. Other people cannot make use of such data. We have to ensure the safety and confidentiality of patients' data at all times. Mr. Ma Fong Kok. There are some drugs that from Hong Kong that can be used on the mainland. On traditional proprietary Chinese medicines. Well, I want to ask about this arrangement. Can you extend it to medicines for internal use? There are now currently a various number of PCMs that are in use on the mainland that cannot be approved in Hong Kong. But due to the pandemic, some of the drugs have been approved for use in Hong Kong. How can we streamline the process? There are more than 2 PCMs on the mainland that could cure COVID-19. So how can we ensure that under the plan, more mainland registered PCMs can be used in Hong Kong? Thank you. Hong Kong registered traditional PCMs for external use have been allowed to be registered and sold in the mainland through a streamlined registration and approval process. Currently, only 5 from the mainland can be used in Hong Kong. There is huge room for development for Hong Kong registered drugs, but the approval process for Hong Kong drugs to be used on the mainland has to go through the mainland's approval. It depends on whether drug manufacturers are willing to take this step. The market in Hong Kong only covers 7 million people. It's really up to how the mainland drug manufacturers view the market.
My follow-up is, of course, if the manufacturer is to meet the Hong Kong standards, then they need to go through cumbersome procedures, and it's not attractive. But from Hong Kong residents' perspective, they're very much in need of the PCMs. So it's about narrowing the differences and taking a more relaxed approach for more PCM products to be listed in Hong Kong. I think you need to give special consideration. Because of COVID, you already approved 2 PCMs very quickly. What about other PCMs? If you continue to have a high threshold, the manufacturers will be deterred. It's a question for the government to consider. It's not for the manufacturers to consider, because the government sets the thresholds. Is all about how you can act reasonably and meet the public's expectation. For medical devices, anything for medical use, be it Chinese or Western medicine, we must have regard to the safety and advocacy of the devices and drugs. Around the world, there are different approval standards. I won't say that our standard is stricter than any particular place in the world. We'll just follow the rules in granting approvals. For PCMs, the same applies. We follow the procedures. We're not setting a particularly high threshold for registering PCMs in Hong Kong. Chairman, just to follow up, the point is, as you mentioned, our country has its own standards, and if the PCM could meet the country standard, shouldn't we be confident in the product as well? Or must you say that we have our own standards? The standard is similar to the standard adopted by other countries, but can't we accept PCMs that meet some mainland standards? Like I explained just now, for the approval of Western medicine, our standards are aligned with other advanced countries. As for PCMs, there's not a major difference. It's just a question of whether the manufacturers are incentivized to submit registration applications. So the ball is in the court of pharmaceutical companies, whether they decide to apply for registration in Hong Kong. It's not for Hong Kong SAR government to help the companies make registration or apply for registration. Next, Dr. David Lam. I have many questions. It's a follow-up question. First of all, for a Hong Kong resident suffering from urgent or serious illness in the Greater Bay Area, of course, the healthcare voucher is not applicable for hospitalized patients. So how should the government deal with them? Because they are not merely tourists or visitors. According to the Secretary, for those who stay there for a longer term, they should take out medical insurance. And as mentioned by Chair and Mr. Kingsley Wong, I support this suggestion as well. Next question on managing chronic diseases. Hong Kong residents living on the mainland would like to see a Hong Kong doctor. If we provide teleconsultation service, it touches on the issue of whether the doctor is authorized to have clinical practice on the other side. So is legislative amendment necessary to amend the legislative framework and allow practitioners to provide service on the other side? So again, whether legislative amendments can be put in place for teleconsultations to be possible and for drugs to be purchased on the other side. The next point on approval of drugs. I understand that the government is considering allowing the recognition of mainland authorities' approval as another CPP. What about drugs jointly researched by a Hong Kong institution and a mainland institution? It's very difficult for the institution to get an overseas certificate. Simply put, no approval will be given because the research is not conducted in the foreign country. So is it possible to consider allowing registration of that drug in Hong Kong using the CPP issued by the mainland authority? Whilst we understand the patient's needs, under the current system, when it comes to cross-border consultation, we could only do our best to help them, but there are different circumstances to each case. Some patients may not be in Shenzhen, they may be in other provinces or other cities in the mainland, and our institution could only do our level best to try to help them. But we cannot meet the needs of every case. As for teleconsultation service, clinically there are constraints. In many countries, there are guidelines that teleconsultation service should only be provided to old cases and follow-up appointments, not new cases, because if you don't see a patient face-to-face, it's not possible to have accurate diagnosis. Also, for teleconsultation, the service can only be provided by major hospitals because otherwise we can't ascertain whether it's a registered specialist. Now the situation gets more complex for cross-border medical services. So if a Hong Kong patient is to receive teleconsultation service in the mainland, for drugs to be dispensed there, it will entail lengthy discussion and drastic reform. On drugs approval, there are different regions and different countries, including the Asian region. And if approval has been given by, say, an Asian country, then it can meet Hong Kong's requirement. We need to set standards because it hinges on the quality of treatment for patients and efficacy. So under the current regime, apart from the mainland or Western countries, we also include approving authorities from Asia. Next, Dr. Stephen Wong. a number of questions from me, as mentioned by the Secretary just now. Under the e-health record system, encrypted files will be sent in a batch to the Hong Kong U Shenzhen Hospital. But it is not convenient. You need to upload and download the files. Are there ways to streamline the procedures? That's the first question. Second question. Is it possible to have mutual access to medical data? Say, after a diagnosis has been made by the Hong Kong U Shenzhen Hospital, if the patient then returns to Hong Kong, can we have information shown in the system on the medical records of the patient in Shenzhen Hospital? Next, the Shenzhen Hospital is equipped with medical devices and equipment such as MRI, and the Shenzhen Hospital can provide services to alleviate the pressure on a public healthcare system. Now, after an MRI examination is conducted in Shenzhen Hospital, will the result be recognized by the hospital authority in Hong Kong? Because they're using the same machine. After taking an MRI exam in Shenzhen, will the result be recognized by Hong Kong doctors? 5 hospitals in the Greater Bay Area are using Hong Kong registered drugs and medical devices in the Greater Bay Area. We started with the Hong Kong U Shenzhen Hospital, and now it's been expanded to 5 other hospitals so that they also recognize Hong Kong registered drugs and medical devices. Can we further extend the e-health record scheme to cover these 5 hospitals as well? I'll give a consolidated reply. First of all, the cross-border use of electronic medical records was a major breakthrough for Hong Kong U Shenzhen Hospital. It was a daunting task, and it could succeed only because the Hong Kong U Shenzhen Hospital was familiar with the operation of hospitals in Hong Kong. We emphasize that this is personal data, and data security is of utmost importance. I would say that it has been a lot of effort coming from colleagues and myself in achieving this. And we need to understand that this represents a breakthrough. In the past, health records could not be shared, and we need to first ascertain that the data are secure, and it's been 2 years since it was implemented in 2020. And now we can ascertain the security of data whilst maintaining quality service for patients. As to whether we can expand the scope to hospitals using Hong Kong registered drugs and medical devices, I think this can be our starting point, and yet administratively this is not an easy task. The Hong Kong U Shenzhen Hospital has a dedicated counter right at the entrance to help patients make applications. They need to go through very cumbersome application procedures because we need to make sure that we have the patient's consent, and that's informed consent after patients have read all the documentation for data to be transferred. As for other hospitals, we need to find out in greater detail whether they can meet the administrative requirements. About sharing of data between the two sides, that would entail connection of the two systems, and data security is a real issue. But of course, we'd like to have better connection with the Greater Bay Area to enhance medical services quality as well. say if a patient goes for a medical checkup in Hong Kong U Shenzhen Hospital, the member's question was whether the examination quality could meet the Hong Kong standard, especially if the Shenzhen Hospital uses the same MRI machine. The imaging aspect would be the same in terms of quality, but the problem lies rather with a report. A rather detailed report would have to be prepared. So it's a question whether both the hardware and software in Shenzhen Hospital could meet the Hong Kong standards. And the HA will continue to liaise with the Shenzhen Hospital.
我哋嘅討論。
Thank you for attending today's meeting. Our next meeting will be on November 22nd at 2:30 in the afternoon to discuss the exchange of cultural arts, sports, and travel. The Secretariat will issue the meeting arrangements later. I now adjourn the meeting.